Hello and welcome. Today, we're diving into a topic that affects countless men but often remains hidden in the shadows: premature ejaculation, or PE. Let's be clear from the start, this is not something to be ashamed of. It's not a reflection of your masculinity or a personal failing. It is a very common medical condition, and the best part is, it's manageable. So, if this is something you're dealing with, know that you are not alone, and there are effective, natural ways to regain control and enhance your sexual well-being. First, what exactly is PE? Simply put, it's when ejaculation occurs sooner than you or your partner would like during sexual activity. This can lead to frustration, anxiety, and even avoidance of intimacy. Understanding the why behind it is the first step toward finding a solution. The causes are often a complex interplay of psychological and biological factors. On the psychological side, performance anxiety is a huge contributor. The more you worry about lasting longer, the more pressure you put on yourself, which ironically can make the problem worse. It becomes a self-fulfilling prophecy. Stress from work, finances, or life in general can also spill over into the bedroom. Depression, guilt, or even issues within your relationship can play a significant role. Sometimes, it can be traced back to early sexual experiences. If your first encounters were rushed or you were worried about being caught, your body might have learned a pattern of quick ejaculation that's now difficult to unlearn. Then there are the biological factors. It's not all in your head. Abnormal hormone levels, particularly serotonin and dopamine, can affect the time it takes to ejaculate. These are neurotransmitters, chemical messengers in your brain that regulate mood and excitement. When they're out of balance, it can disrupt your body's ejaculatory reflex. In some cases, there might be a genetic predisposition. Other physical issues, like inflammation or infection of the prostate or urethra, can also contribute to PE. So, it's a real mix of mind and body. The great news is that you have a tremendous amount of power to influence this. Let's start with some of the most effective natural strategies: behavioral techniques. These are like physical therapy for your sexual response. The first one is the start-stop method. It's exactly what it sounds like. During solo or partner play, you stimulate yourself until you feel you're about to reach the point of no return, and then you stop all stimulation completely. You wait for the sensation to subside, which might take about 30 seconds. Once you feel calm again, you start again. You repeat this cycle 3 to 5 times before finally allowing yourself to ejaculate on the last go. This practice helps you become more aware of your body's signals and teaches you that you can approach that edge without going over it. A similar method is the squeeze technique. It follows the same principle of stimulating yourself close to the point of ejaculation. But instead of just stopping, you or your partner gently squeezes the end of your penis, right where the head joins the shaft. You apply firm pressure for several seconds until the urge to ejaculate passes. Then you wait about 30 seconds before resuming stimulation. Like the start-stop method, repeating this process trains your brain and body to delay ejaculation. It takes practice and patience, but many men find these techniques incredibly empowering. Beyond these specific exercises, your overall lifestyle plays a massive role. Let's talk about diet. What you eat can directly impact your sexual health. 2 minerals are particularly important here: zinc and magnesium. Zinc is crucial for producing testosterone and maintaining healthy sperm. A deficiency in zinc has been linked to sexual dysfunction. You can find it in foods like oysters, which are famously known as an aphrodisiac for a reason, but also in beef, pumpkin seeds, lentils, and chickpeas. Magnesium is another key player. It's involved in over 300 biochemical reactions in your body, including those related to muscle relaxation and nerve function, which can help calm the nervous system and potentially delay ejaculation. Great sources of magnesium include spinach and other leafy greens, almonds, avocados, dark chocolate, and bananas. Exercise is another non-negotiable. Regular physical activity, especially cardiovascular exercise like running, swimming, or cycling, improves blood flow throughout your body, including to the pelvic area. Better circulation means better sexual function. Exercise is also one of the best stress busters out there. It releases endorphins, which are natural mood elevators, helping to combat the anxiety and stress that often fuel PE. Speaking of stress, actively managing it is critical. Techniques like mindfulness and meditation can be game changers. Mindfulness teaches you to stay present in the moment, rather than getting caught up in anxious thoughts about your performance. When you're having sex, try to focus on the physical sensations, the touch, the connection with your partner, instead of the running commentary in your head. Deep breathing exercises can also calm your nervous system in real time. If you feel yourself getting anxious during intimacy, take a few slow, deep breaths to ground yourself. Yoga is also fantastic because it combines physical postures, breathing techniques, and meditation. Now, let us touch upon some natural herbs and supplements that have been traditionally used to support male sexual health. One of the most well-known is ashwagandha. This is an adaptogenic herb, which means it helps your body adapt to and manage stress. By lowering cortisol, the stress hormone, ashwagandha can reduce the anxiety component of PE, helping you feel more relaxed and in control. Another popular herb is ginseng, particularly Panax ginseng. It has been used for centuries in traditional Chinese medicine to enhance stamina and sexual performance. It's believed to work by influencing the central nervous system and affecting hormone levels, which may help improve ejaculatory control and erectile function. Some research also points to a potential link between vitamin D levels and sexual function. While more studies are needed specifically on PE, ensuring you have adequate vitamin D levels is important for overall health, including hormonal balance. A word of caution here: while these natural remedies can be very helpful, they are not magic pills. It's absolutely crucial to talk to a healthcare professional, like your doctor or a naturopath, before starting any new supplement. They can help you determine the right dosage and make sure it won't interact with any other medications you might be taking or pre-existing conditions you have. Self-diagnosing and self-prescribing can be risky. To bring it all together, premature ejaculation is a common, multifaceted condition, but it is far from a life sentence. By taking a holistic approach, you can make significant improvements. Start by practicing the behavioral techniques, like the start, stop, or squeeze methods, to retrain your body's response. Clean up your diet by incorporating zinc and magnesium-rich foods. Make regular exercise and stress management a priority. And consider exploring supportive herbs and supplements, but only after consulting with a healthcare provider. Most importantly, remember that open communication with your partner is key. Talking about it can reduce pressure and anxiety for both of you, and you can work on these techniques together as a team. This journey is about more than just lasting longer. It's about improving your confidence, reducing anxiety, and fostering a more satisfying and connected intimate life. You have the power to make a change. Thanks so much for watching. If you found this video helpful, please give it a thumbs up and consider subscribing for more content on health and wellness. See you next time.